I felt like trash. These are the words of a 15-year-old girl whose HIV status was disclosed without her consent during the COVID-19 pandemic. Her words echo the pain, the fear, the stigma that many adolescents living with HIV experienced during the pandemic and still experience today. My PhD research explored the impact of the COVID-19 pandemic and vaccine rollout on the treatment experiences and mental well-being of adolescents living with HIV in Cape Town, South Africa. Using both qualitative and quantitative research methods, I undertook my research in 4 phases. A review of global literature found that the pandemic not only disrupted HIV care, but also deepened existing vulnerabilities and worsened mental health. In phases 2 and 3 of my research, I turned to the voices of the people. Interviews with healthcare workers explored the challenges experienced during the pandemic, and adolescents used cameras to share and tell their stories. Their images not only captured the pain, isolation, and stigma that they experienced, but also echoed their hope, their resilience, and their deep desire to be treated with dignity. A survey on COVID-19 vaccine uptake and hesitancy found that factors such as misinformation, mistrust, and fear often shaped uptake within this population and often left young people feeling unprotected. So put together, these 4 phases showed that adolescents were carrying 3 burdens at once: HIV, the struggles of adolescence, and the weight of a global pandemic. But it also showed their hope, their resilience, and their ability to thrive amidst crises. But why does this matter now? Because the impact of the COVID pandemic is still with us. Because future crises are inevitable. Because if we do not center the voices of adolescents, we risk losing them to treatment failure, poor mental health, or even worse. My research calls for youth-friendly, resilient health systems where adolescents do not feel like trash, but are seen as equal partners in their own care and within HIV response. This bin is not where the voices belong. My PhD and mission is to ensure that their voices, their stories, their needs, their resilience are seen, valued, and acted upon.